just want to say thank you to the break sponsors, which were Hatch, Hardy Stevenson and Associates, and Metrolinx. And also thank you to our session 8 sponsors, GHD. So session H is going to be communication and consultation, integrating diverse voices. Our moderator for this session will be Katrina McLeod, Senior Stakeholder Engagement Specialist with GHD. So I also just want to mention that for session 8, there's just one presentation, so we're going to combine the Q&A with session 9. So there's a few presentations, so maybe jot down your questions to remember them throughout. Thank you.
Thank you. I have a very easy job this afternoon, which is just to introduce this really interesting topic with a couple of amazing practitioners. So Elaine and Dr. Faiza Wahid are going to be talking about health impact assessments and specifically engaging Indigenous peoples and community members in health impact assessments. In particular, how using a GBA plus approach can improve project outcomes. So really looking forward to this session. And as mentioned, we'll do this one and then we'll have a couple more presentations and Q&A after that. So can I have my presenters? Oh, there you are. I'm not going to present this.
Okay, good afternoon everyone. My name is Elaine Larocque and I'm an environmental risk assessor at Intrinsic. So today I'll be presenting on conducting engagement in health impact assessments. Today my discussion will focus on our approach and ability to integrate diverse voices when conducting effective engagement and consultation for health impact assessments, or HIAs for short, conducted on resource development and major infrastructure development projects. So I'll aim to highlight challenges and barriers faced when conducting effective engagement, as well as demonstrate positive outcomes and benefits that would outweigh said challenges. So I'll also discuss our experience with past projects to highlight some aspects of engagement with Indigenous communities, as well as other stakeholders by employing a gender-based analysis plus approach in our HIAs. So my outline for today, we'll start by discussing the health impact assessment process, as well as the foundational principles of HIA, and then a little bit about where health impact assessment fits into Canada's impact assessment process, and then why health impact assessments can support major project development. And then that'll be followed by a brief overview of Gender-Based Analysis Plus, what it is, its application in projects, and then finally going into engagement within health impact assessment, conducting that, what forms it takes, and then with a case study at the very end. So health impact assessments, or the HIA, is a practical approach used to examine the potential health effects of a policy, program, or project, particularly on vulnerable or disadvantaged groups. HIA provides decision makers and stakeholders with comprehensive information about the consequences on the health of interventions, policies, and projects. So guidance documents typically break down the health impact assessment into the following steps that we see here, and it outlines how to undertake an HIA. So we have the screening step to start, which is where we would determine if an HIA is useful or adds value to our assessment process, and it would come out with 3 different outcomes. So yes, an HIA is needed, or no, an HIA is not needed because the effects are negligible, or no, an HIA is not needed because the effects are already known. So if we've determined that an HIA is useful, then we would move on to our scoping step. This is where we would plan out our health impact assessment approach and then select our determinants of health that will be assessed. And this is where we identify what health risks and benefits to consider. Then we move on to our assessment phase. We would identify impacts to health and the distribution of those effects by gathering and analyzing data. This is also where we characterize the health impacts for each determinant of health identified during the scoping step. During the recommendation step, where we would develop strategies to enhance any health benefits and minimize any potential harms that were identified in the assessment step, and ideally these recommendations would incorporate input from stakeholders and rights holders. During our reporting step, we want to disseminate information and then clearly communicate those results to rights holders and stakeholders. And then finally, we have our evaluation or monitoring step, and that allows us to understand the effectiveness of the HIA and monitor impacts of the project over time. So the information can be used to support ongoing monitoring impacts and inform changes to support sustainable community development. And then throughout this entire process, with that gray arrow there, we have engagement with either community members or stakeholders as the crucial part of the health impact assessment. And you can see that it's all the way through. It's not just at one particular step. So now we have our 5 foundational principles of HIA. We have equity, democracy, holistic view of health, sustainability, and ethical use of evidence. Equity being our foundational value of health impact assessment and is applied to all stages, so all other principles are looked through this equity lens. And equity in terms of health is said to exist when all people can reach their full potential and are not disadvantaged from attaining it because of their race, ethnicity, religion, gender, age, social class, socioeconomic status, sexual orientation, or other socially determined circumstances. Then we have democracy, and that states that health impact assessment processes are participatory and democratic by design. The right for communities to participate in the process being one of them, and this is really where our engagement piece fits into this. So we want to ensure that those who would be most impacted by a given decision have their perspectives heard and are involved in every step of the HIA. Then we have holistic view of health. So HIAs assess health and well-being using a holistic approach, recognizing that health is determined by a wide range of factors from many different sectors and that community characteristics dictate the factors that determine health. Looking at our sustainability, meaning that HIAs consider both the short and long-term effects of the programs, projects, and or policies implemented. So we want to ensure that decisions made now do not result in unfair burdens to our future. And then lastly, we have ethical use of evidence, where the health impact assessment process is data-driven and then supports transparent and rigorous decision-making. So an equitable HIA process brings together quantitative, demographic, and then qualitative community data. So now a little bit where HIA fits into Canada's IA process. Federally designated projects are required to assess human health, employing best practices in health impact assessment methods under the Impact Assessment Act. The potential impacts on human health and well-being are of a greater focus here. The Impact Assessment Agency of Canada prepares tailored impact statement guidelines for designated projects as part of the planning phase of the IA process. So the tailored impact statement guidelines provides the direction and requirements, which includes a human health assessment. And so HIA is completed during the planning and impacts phases, along with other IA study streams such as air quality, water quality, noise, socioeconomic assessments, things like that. And then engagement with potentially affected rights holders and stakeholders is an essential part of the AIA process from the planning phase onwards. Under the impact assessment process, HIAs evaluate both the potential positive and negative health impacts of federally designated projects, not only from exposure to the built and natural environment, but from various determinants of health, such as social, cultural, spiritual, economic, mental well-being. So why is HIA an important tool in assessing impacts from major projects? Health impact assessments can support major project development by helping to influence decision and policy making. They're also a useful way to engage with members of the public affected by a particular proposal. HIA incorporates meaningful community engagement, which can increase the community or public awareness and inform better decision making. Health impact assessment is also a useful and valuable process which can support both the local and Indigenous governments and help authorities meet their goals. HIAs bring an intersectional or GBA plus analysis lens to the project and identify those who will be most affected, and we'll touch on this shortly. But for example, if you're looking at a transportation project, that would affect health, so those living in the area could have concerns about traffic and volume, air pollution, noise, bike lanes, etc. So Gender-Based Analysis Plus requires examining a wide range of factors, including race, ethnicity, age, mental or physical ability, and the interaction between these factors that influences our experience. So an intersectional approach, which is really demonstrated through that figure from Women in Gender Equality Canada. So we're not identified just by our age, our gender, our religion. It's really an intersectional approach from all of those factors. Gender-Based Analysis Plus is a required analytical approach for any projects operating under Section 22 of the IA Act and is considered part of the EAIA process. Gender-Based Analysis Plus recognizes that historical and current power structures have shaped society and created inequalities. So in the context of EAIA, Gender-Based Analysis Plus is intended as a means to understand and assess how potential project effects could disproportionately impact more vulnerable groups, including women, youth, two-spirit, gender diverse persons, disabled persons, elders, with respect to the project. So it's particularly important to consider how the impacts, benefits, and risks of the project could be unequally distributed across diverse groups within a community. And then we want to develop targeted plans and mechanisms that can be put in place to avoid and mitigate impacts and or compensate these groups. So Gender-Based Analysis Plus helps us recognize our assumptions and challenges them by looking at how different groups are affected differently. Gender-Based Analysis Plus has similar requirements as our health impact assessments, such as the engagement of rights holders and stakeholders. And then we can actually integrate the Gender-Based Analysis Plus into our health impact assessment process when completing engagement and data collection. So how do we apply this approach? Again, from the Women and Gender Equality Canada wage, this figure just outlines how we would apply that. So we'd identify the context, gender, and diversity issues. We'd want to challenge our assumptions, so whether that's on a personal level or assumptions in the workplace. Then we want to gather our facts by conducting research, so gender disaggregated data and other intersecting factors, and identify any data gaps, as well as consulting stakeholders. Then we develop options and make recommendations. We monitor and evaluate, so we identify groups who are positively or negatively affected and highlight data gaps. We then communicate the initiative and document the process and findings throughout. So now an example using Gender-Based Analysis Plus. If you had X number of workers, for example, being hired in a mine over the next several years, these are some questions that you could ask yourself using a Gender-Based Analysis Plus lens. When you're so what are you looking at the current socio-demographic characteristics of the mining and exploration sector workforce? You could also look at if there are any segments of the population that are underrepresented in the workforce. So if we're looking at mining, for example, that's typically a male-dominated field. So in this case, are women underrepresented in the area? Are Indigenous peoples? Are young adults? And once we've identified these groups, we can ask ourselves, are there any barriers to employment for these underrepresented groups? So for example, shift work, remote location, employer stereotypes, or safety. And then another question we can ask ourselves, in developing our approach to the issue, have we consulted a wide range of rights holders and stakeholders, including those previously identified underrepresented groups? So now we're looking at what engagement in HIA looks like. So as I've stated earlier, ideally this should take place throughout the entire HIA process. The screening and scoping steps, which were 1 and 2 at the beginning of the presentation, involves developing a rights holder and stakeholder engagement plan. So we want to identify the rights holders and stakeholders to be engaged. This usually produces a large number of relevant people and organizations. And then HIA is a framework to implicate stakeholders in a meaningful way, allowing their messages to be heard. And the process draws on all resources in the project and wider community to help guide decision making, including developers and planners and those living in the community, particularly, again, the most vulnerable members of the community and those directly impacted by the project or policy. So we would also want to determine how to conduct our engagement. So we ask ourselves what's appropriate for this project. Stakeholder engagement can look very different depending on the context of the work you're doing. Rarely is it straightforward, and there's no single approach for engaging the diverse community groups, decision makers, and practitioners who are key to successful HIA work. We want to build good relationships from the beginning. We also want to build rapport with all stakeholders early on in the process, be persistent, have good relationship building, and it takes time and energy. You want to establish partnerships with an organization familiar to the community stakeholders with the intent of maintaining that partnership beyond the life of the HIA. We want to be open to seeking opportunities for information sharing with stakeholders that goes beyond the HIA, and engagement opportunities should pose no barriers. So we want to ensure that meeting locations are physically and culturally accessible and convenient for stakeholders to attend. So you could meet with stakeholders in environments that are familiar to them, so pre-existing meetings or community events. So once we've developed our rights holders and stakeholder engagement plan, we can decide what are the best forms of engagement to utilize throughout the health impact assessment and at what steps of the process. So for example, you may conduct focus groups at the beginning of the assessment in order to identify those determinants of health that we're going to assess throughout the project. We can also hand out surveys online or in person to make those more accessible. We can hold open houses, town hall meetings, information sessions, And then larger projects may have websites or other forms of social media in order to communicate that to all members of the public and interested parties. So if we've identified the rights holders and stakeholders for the project study area, we can determine who the vulnerable subgroups are and if they may be disproportionately impacted. So we want to achieve effective communication throughout the project using our chosen forms of engagement by establishing clear and consistent communication channels, what methods we use, and the frequency of that communication. We also want to consider any cultural, linguistic, and ethical aspects of communication to avoid any misunderstandings or conflicts. And while conducting engagement, we're trying to align many different points of views, and more often than not, there are resource constraints that we have to work within, like the amount of time or budget. So now an example from our work when we visited and are doing an HIA with a remote community in Northern Ontario. So some form of the engagement that we used were providing information and Q&A sessions over meals with the community. So we were actually able to talk to community members and ask them what they thought the best engagement strategy was for their community and how to get the most people out to our information sessions and involved. And then the feedback that we received was to hold these sessions over meals like breakfast, lunch, dinner. That way we could make it more informal setting, and then people would feel less pressure to attend. They could come grab some food and listen to us while we talked, and figure out like what we were trying to achieve from our visit. We always want to build rapport and before asking any sensitive and vulnerable questions, and use a trauma-informed approach by acknowledging the history of trauma and creating a safe place, being respectful, and meeting individuals in their own spaces. We also held focus groups within the community for elders, women, men, youth, land users, and 2S LGBTQ plus individuals. Again, often while having food or drinks on hand, even going like so far as to play board games with the youth to interact with them. We wanted to determine the project and health impacts from each of these individual groups. So for this project, we also had surveys involved, so we had both in person and online. And for this, it was important to coordinate with other engagement teams to avoid engagement fatigue. So we didn't want to hand them our 20-page health survey and have the socioeconomic study do the same. We really wanted to coordinate with them, identify any data gaps in what we already knew, and we just didn't want to waste any of their time either. So some of the challenges that we faced were language barriers for some, but we did have community members offer translation services for interviews and focus groups. COVID was a pretty large challenge, and it ended up postponing some of our focus groups and information sessions the first time as we couldn't gather in large groups. Access to reliable internet was also sometimes a challenge as many meetings were forced to be held on Zoom or Teams. However, despite COVID being a pretty big obstacle, we were able to conduct our engagement in person, which is always our best thinking of way of doing it. And so we successfully had those information sessions and focus groups. And thank you.